We all feel burnout sometimes, and the helping professions, including medicine, nursing, psychological counseling, social work, and education, are not immune from it. Having a perfect work-life balance seems like an illusion. In 1970, an American psychologist, Herbert Freudenberger, coined the term burnout to describe the consequences of severe stress and high ideals experienced by people working in the helping professions. In most parts of Canada, doctors usually work 100-hour work weeks at up to 7 monthly 24-hour call shifts. This does not include time spent on continuing education or professional development, attending various conferences, meetings, and seminars. Burnout is called a disease of our modern time, with more and more people becoming its victims. Adding to the burden, burnout is often not recognized and detected until it's too late. An examination of the burnout literature reveals a prevalent rate of up to 45% of medical students and alarming 75% of residents, depending on the specialty, as well as practicing physicians. Helping professionals and burnout. Effects of burnout. Disengaged and demotivated from your job. You have started disliking your job. You shirk away from your responsibilities and are always behind on your deadlines. Exhaustion. You feel drained emotionally and psychologically. Impaired concentration. You don't feel like completing the task and you'll find difficulty in attention to details. Work-life imbalance. You feel that you are not able to devote time for friends and family. You are not happy with your work performance, even when spending extra hours at your workplace. Anxiety and depression. The symptoms of burnout can be quite similar to that of stress or depression. You constantly feel a sense of lack of accomplishment. Vulnerability to illness. Physical symptoms can include cold, chest pain, heart palpitations, dizziness, fainting, tension, headaches, migraine headaches, shortness of breath, low appetite, or overeating, chronic fatigue. This could also lead to insomnia. Assessment. The Maslow Burnout Inventory operationalizes burnout as a three-dimensional syndrome made up of exhaustion, cynicism, and inefficacy. Prevention and treatment. What can be done at the individual level? Acknowledge the burnout. The first step of prevention of burnout is to accept its existence in your life. Identify the reasons for burnout and make a plan to address the issues properly. Inadequate sleep. Lack of sleep affects your cognitive abilities, and there's no substitute for good night's sleep. Share your feelings. Sometimes the toughest things about feelings is sharing them with others. Reach out to your trusted companion or professional coach or psychotherapist. Delegation of responsibilities. The delegation of responsibilities is an important means of reducing burnout. Managing stress. Taking some time out for hobbies or getting a hobby can give you a fresh dose of energy. Spending quality time with your pets can also help reduce stress. What can be done at the organizational level? Framing a policy. Follow the guidelines from the national committee in your country. Training employees. It can be a combination of burnout prevention program, relaxation techniques, cognitive behavioral therapy, and cognitive restructuring. Show them your appreciation. Employees who are not appreciated often feel that their work and efforts are not recognized at all. Employment Assistance Program, or EAP. An employment assistance program is counseling service offered by employers to employees, either in-house, outsourced, or through insurance. Human resources should make an effort to inform every employee about the program. Burnout is not just a fashionable term used to describe a bad day at work. Understanding the factors of burnout is important in recognizing it, and a strong collaboration between employee and employer is important to prevent burnout.